Now to the story of the second infant. Baby Theo's health condition was also discovered in the womb. His belly button was not developing properly, causing his intestines to grow externally. But doctors used a pioneering surgery by partially exposing the mother's womb and then gently pushed his organs back inside his stomach. Now baby Theo is a thriving 5-month-old infant. Let's bring in Dr. Sundeep Keswani. He is the pediatric and fetal surgeon who performed the operation in November. Dr. Keswani, thank you so much for coming on today.
Hello, Veronica, and thank you so much for having us and covering this story.
If baby Theo had survived without being treated in the womb, would he likely have faced a longer and more difficult medical road to recovery?
Yeah, well, thanks. It's a great question. You know, I think when we look at what baby Theo was at the time that we diagnosed him, we feel very certain that this baby would have had a very complicated course. 3 to 6 months of time in the neonatal intensive care unit, feeding problems for 2 to 3 years potentially, and some of these patients even go on to pediatric transplant. And in the best children's hospitals, 1 in 10 patients still die. So yes, challenging at best.
What made Theo's condition so challenging, and how did your team prepare for this operation?
So I think it was just the way that the bowel appeared in utero, and with this condition in gastroschisis, the signs were there that we knew that this was going to be not the outcome that this family wanted. And for us, we've been thinking about doing this in utero for now 10 years, and there's been so many dollars invested in the preclinical models to get us to where we are today to be able to offer this in humans. So we felt confident that we could at least try to offer this to Maisie and her family to give them the best chance for a best outcome.
Does Theo's story offer hope to families who are told during pregnancy that their baby may have a serious condition or may not survive? And what would you want to see those parents to know?
You know, I think trust your doctors. This definitely gives hope. I think this is not the first to be totally transparent. This field was developed by Mike Harrison 50 years ago, and it's been evolving. This is the latest in a series of evolutions in technique that can really help babies when they are told nothing else can happen. Maybe something else can happen, and we certainly are trying to push the envelope to help every child.
You have done 4 of these surgeries. Baby Theo is number 3. This was a medical trial, but is this the new frontier of medicine, and do you expect that we'll see more complex operations being performed in the womb in the future?
I think that this fetoscopic technique takes out a lot of the risk, not all the risk, but a lot of the risk for the mother and the baby. And so it's going to lead to more surgeries and more opportunities for more babies to be helped. I would say that this is, as you said, a trial. We need to finish this trial to be able to really tell mothers that this is a safe and feasible procedure. And then, of course, we're going to test it in a multi-centered randomized trial to really make sure that when we look at mothers, that we're offering them the best for their babies, the best for their families, and that's our goal.
Dr. Sundeep Keswani, thank you so much for being with us today and telling us more about this story.
Thank you so much for having us and covering this story. Thank you.